Good evening, everyone, or good morning, good afternoon, depending where you're joining us from. My name is Dr. Zipporah Ali. I'll be moderating this session this evening, and I would like to welcome everybody for this session. It's going to be an exciting session. We have two very good, able speakers. I'll introduce them in a while. Our session is titled Telling Our Unique Stories, Abstract Writing and Opportunities at the 7th National Palliative Care Conference in 2026. So we'll be hearing more about the conference from David. We know that we have a conference coming up on palliative care in Kenya next year, and we have two presenters today. I will start with introducing the first presenter. Our first presenter is Mr. David Musyoki. Musyoki has 17 years of dedicated service in palliative care. He's also the Executive Director of Kenya Hospices and Palliative Care Association, popularly known as Kehpca, where he provides overall oversight and strategic leadership to advance Kehpca's vision of quality palliative care for all in Kenya. So David is currently pursuing a Masters of Arts in Leadership at the Pan-African Christian University, complementing his bachelor's degree in nursing, and also has specialized training in palliative care and professional certifications from renowned institutions, including University of Dundee and, of course, Oxford Brookes University. He's passionate about amplifying the voices of palliative care and continues to champion policies, partnerships, and innovations that improve access to quality palliative care for patients and their families. Apart from his professional life, David also finds fulfillment in serving humanity through various community and church initiatives, and he treasures spending time with his family in Ushago. His Ushago is in Machakos, as far as I remember. So that will be our first speaker, and I hope I'm audible. I am audible, I hope. So that will be our first. I am, yes. So I'll introduce our second speaker so that when David is done, I'll invite our second speaker to speak so that we don't interfere with the introductions. Our second speaker will also be Dr. Esther Muinga. Dr. Esther Muinga is a seasoned medical doctor. I don't know what that means, but it's interesting. And palliative care specialist with over 15 years of experience in healthcare, policy, and advocacy. Dr. Muinga holds advanced degrees from Makerere University in palliative care and the University of Nairobi, medical degree, and currently serves in Kenya's Ministry of Health as the palliative care lead in the healthy aging, palliative care, and older persons division. That is fantastic news, Dr. Muinga. Congratulations. Her work focuses on integrating palliative care and older persons services into national health strategy with a strong emphasis on pain management and dignity in aging. She mentors healthcare professionals and leads training, research, and policy initiatives to improve care for those with life-threatening illnesses. So this will be our two speakers, and I'm really proud to say that I know them personally. I have worked with these wonderful people, and I'm sure they'll make this session very interesting, and especially as they champion palliative care in our country. So I will invite Mr. Musyoki, to go ahead and give us his presentation. And please, for any questions, we have a question and answer section. You can put your questions there, and we'll come back to questions once we are done with the sessions. Thank you.
Hey, good afternoon, good evening, good morning, depending on our time zones. Thank you, Zippy, for being a great mentor and very passionate palliative care specialist. I have learned quite a deal from you as I worked under her or under you for quite some while. And it's humbling to have this opportunity. I hope I'm audible. Kindly confirm.
Yes, you are. And we can see your slides.
Thank you. Yeah, so for the audience, we are glad to have another opportunity to have this event. And it's not just an event, but it's a an opportunity to amplify our voices as the palliative care family. And we do this jointly as an association, and of course with great backing from the Ministry of Health. And we thought, let's have some conversation about how to tell our unique stories, because the stories are uniquely ours. For someone who is in Kerugoya and has a successful experience, they can only be the ones who tell that story, and very well. The same way as somebody who is in Sindo on the other side of the country, it is difficult for me to tell their story. And so we have an opportunity to be ourselves and tell the stories ourselves based on our experiences. And again, being very mindful of the people that have experienced their own unique journeys, and this would be the patients and the caregivers. We have prepared this opportunity or this platform to allow everyone, be it carers, be it people with experience, lived experiences, be it policymakers and even the general public, to say our unique experiences through this conference. And it's our 7th National Palliative Care Conference that we're planning for. We are excited to say we can work as we unwind in the coastal region. If you've not been to Shanzu, this is a good opportunity for you to be in the coasts and enjoy the North Coast breeze and good environment. And as we enjoy all this, we learn, and we'll have some networking partnerships and build palliative care. This is follow-up to the 6th National Conference that happened in Kisumu. And I'm really happy and excited to report that follow-up to that conference in Kisumu in 2023, there has been such a huge response matters palliative care in that county. And so we're hoping that bigger and better steps or strategies will be laid by our having the opportunity to do this conference in the coast. So mark your calendars, the 25th to the 27th of February, 2026. We have quite some time to prepare. And as we prepare, Dr. Esther Mwinga will tell us, how to tell the stories in a scientific way. But mine is to lay a foundation. And why do we have to tell this story? The stories we are telling is about palliative care. Sadly, the many people that require palliative care, unfortunately, do not access that service. Based on statistics, about 800,000 people require palliative care in Kenya annually. That's adults, but sadly only about 30,000 individuals access this care. And so my question is, shouldn't these warriors, more sadly, for children or pediatrics patients who need this service, only less than 5% access this service. While this is not very sweet to hear in terms of the gap, there has been quite some response so that we get palliative care highlighted as a key service and also as a priority, and more specifically in our health sector. So in 2021, we jointly with other partners in the Ministry of Health were able to launch the first national palliative care policy. And that policy outlines that it is everyone's business to support palliative care initiatives. So during this conference, we hope we will have more people coming on board, more people involved, more people, having interest. And so that is why we have these kind of conversations. You may ask me, what is palliative care? Because I know majority of the people here may have the understanding, but so that we all move together, because palliative care is everyone's business, I thought, let me just simplify what palliative care is. So it's a specialized medical care for persons with life-threatening illnesses or serious illnesses or illnesses that are hard to cure. It focuses on the relief of symptoms and the stress that is accompanied or caused by these serious illnesses. The goal of palliative care is to improve the quality of life for the patient and also for the people around the patient. Could be the family or caregivers with the patient. It is usually provided by a specialized trained team of healthcare professionals, and these include doctors, nurses, clinical officers, social workers, and other trained specialists. And these teams usually work together with the other healthcare professionals in our centers or in our health facilities. So it provides an extra layer of support to the patient because the patient is in quite some need. It is important to note that it is appropriate at any age and at any stage of that serious illness. And we emphasize, based on WHO definition, that palliative care should be provided from the time a diagnosis of a life-threatening illness is done. So when the diagnosis is done, that is when palliative care should start. And it can be provided along with curative kind of treatment. And therefore, the emphasis here is that we should not wait until, the end, when many times in the past, people used to say there is nothing more that can be done. We demystified and removed that statement from our vocabulary, that there is a lot that can still be done, despite the fact that a patient is diagnosed with a serious illness or a life-threatening illness. So that is what palliative care does. How shall we do it in the conference? The theme for the conference is very wide, and I read universal access to compassionate and comprehensive palliative care in Kenya. So I presume we've heard about UHC, universal health coverage. And so the theme for our conference picks from that big umbrella where we need to provide that universal access to care so that the huge number of patients who do not access care, as I showed earlier, are able to access. This care should be compassionate, and therefore the human aspect of care, the humanity and the dignity aspects are well covered. And again, it should be comprehensive enough to cater for all the needs of that patient and the families. So that is our theme. And based on the theme, then we picked, or we were able to develop 7 key areas that we would want to focus on. And therefore, as we tell our stories, I'm hoping our stories would be classified under either the 7 or within one of the 7 areas that I list here. So number 1 is about expanding access to palliative care nationwide. As we speak, Kehpca has had a lot of advocacy for palliative care, which has yielded, and we have about 122 facilities that provide palliative care in the country. That is quite some step based on the trajectory, but it is not yet enough. So expanding access so that we can talk about how we've been able to grow palliative care services, be it as inpatient, be it as outpatient, or community initiatives, or an integrated service within other areas. So what is your story about access? Number 2 is strengthening the policy and the legal framework. So what is your experience? What is your story around the palliative care policy landscape in your area? Please tell that story. Thirdly, is around skilled and motivated workforce. So is your story about how you received training and how you were empowered, how you're motivated to wake up every other day and seek to provide support to the patients that need your support, your care? Please tell out that story. Fourthly is around overlooked population. So programming for areas around pediatric palliative care, the elderly who are very key, the adolescents, the youth, and any other. So this what is in brackets are just examples. It could be the marginalized, women, children who are destitute, and any other populations that we feel could be overlooked. And so what is your story about that population? Number 5 is the area on financing. How well are we financed? How well are we factored palliative care in our budgets as a national response? How well is palliative care a priority even in insurance kind of platforms? So a discussion around financing based on your stories is highly welcome. Number 6 is around voices of people with lived experiences. This cannot be ignored. Recently, during the NCI summit, there was a huge volume or voices for people with lived experiences, and they usually say, nothing for us without us. So this conference also would want to, or we would want in this conference to hear those stories and your voices as well. Finally, in the era we are in, technology innovation is key. Artificial intelligence is key. Medicine, technology in medicine is very key. And research as a backbone of any scientific kind of initiative. And hence, therefore, what is your story around all these areas? Have you done a research or a paper or published a paper that talks about palliative care and has a story for you? Please tell it out. Who is our audience? We expect that we'll have medical practitioners, nurses, we'll have clinical teams, the whole landscape of healthcare professionals. We expect that we'll have the Ministry of Health and county officials, especially county health officials. We expect to have educators and researchers from training institutions and other sectors. We expect to have caregivers and persons with lived experiences. We expect to host development partners who are key and have been very important in supporting palliative care initiatives, other CSOs and NGOs. We expect to have pharmaceutical and health tech companies, especially as exhibitors and movers and people that help to lubricate the work that we do. We expect to have students and allied professionals, as well as the general public. So our stories would be well put as we speak to these people. Just for your information, and the website, the conference website has more information on some of these things. So for the exhibitors, we have these categories, and we welcome discussions around either this kind of categorization or even more. So we're calling upon all of us to support the conference in any way we can. For the fees, in terms of registration, for those who have paid up subscription at the association as members, because Kehpca is a member organization, the institutional membership guarantees 2 slots at the rate of 22,000. And if there are more than 2 members from each institution, then the third and the fourth and the rest will pay up from 24,000. For friends who are individuals who have subscribed as friends of the association, at least they will get the subsidized rates of 22,000. Non-members, those who haven't subscribed, will pay 24,000 for their registration. Regional delegates within Africa will pay $250. International delegates $300. And if someone who plans to attend just daily, their payment is 8,000. and this does not include dinner for the daily rate, but the rest up there have gala dinner inclusive. So as I end, I welcome all. Karibuni nyote ama wote, pamoja tufanye washa hii. We look forward to engaging discussions, thought-provoking workshops, dynamic networking sessions that drive change and improve the quality of life of our patients. So ladies and gentlemen, thank you. I'll be happy to get comments or questions at the end. Thank you very much.
Thank you very much, David. That was very insightful. For those of us who are thinking of going to the conference, we now have information about the theme, the tracks that we should be submitting our abstracts to, and we'll be looking into abstracts in the next session. We have information about payment. I like the fact that you're giving us an opportunity to pay in installments. That helps a lot. That gives us about 5 months to start paying. So if you divide that amount with 5 months, it's actually then affordable to many. I hope with this information, we have been able to interest many of you, and that you'll also pass this same information to others, your colleagues, so that we get as many people as possible coming to the conference and discuss matters concerning palliative care needs in this country. Thank you, David. I'll now hand over to Dr. Mwinga to tell us about the abstracts. David will come back to questions after Dr. Mwinga has finished. Asante. Dr. Mwinga, over to you.
All right, thank you and good evening or good, is it morning or afternoon, wherever we are. Let me share my screen.
You're sharing it, maybe put it on PowerPoint? On slideshows, yeah, sorry.
Is it,
sorry,
is it on slideshow?
No, it's not on, yeah, now it is, thank you.
It's on slideshow, okay.
Yeah,
I think it's the network, but
okay.
If it hangs, just let me know. Good evening and or greetings from wherever you are. My name is Dr. Mwinga, and I'll be taking us through how to write a winning abstract. And Zippy, we can even call it a seasoned abstract. So
I'm learning, in my old age, I'm learning new words. Thank you.
All right, just building on what David has already talked about, we have the conference coming up, and the abstract submission window is open. And this is your chance to think about what you want to share with us. Share your winning stories, share your adventure, share your research. And based on what you've been doing, you need to align this with the conference abstracts, tracts that are already listed within the conference website. So we have 6 tracts, and for you to submit a paper, it has to be aligning to one of the 6. So number 1 looks at palliative care integration. It could be anything about integration as long as it relates to that. And there are some sub-themes under this. If you go to the website, you'll be able to see this. Then number 2, we are looking at palliative care enablers and equity. So looking at systems and how we maintain sustainability, even as we provide palliative care services. Number 3 is advancing compassionate palliative care in the community. Remember, palliative care can be offered at the facility, in the home, in the community. So what are you doing where you are so that palliative care is advancing within the community? Then number 4, we are looking at innovation, creativity in palliative care. And this is where you talk about technology, you'll talk about new methods of doing things, new methods of providing care or services, or even apps or devices that have been developed so that palliative care is advanced within your region or within the facility you're working in. Then number 5, we are looking at palliative care for children. So anything that touches on children, and it could now cut from the other 5 abstract tracks that I've talked about. So anything about children, will fall in the pediatric palliative care track. And I'm encouraging all of us because palliative care for children is one of the fields that needs to grow in Kenya. If you have any activities you've been doing for children, here is your chance to share that. Then the sixth one is inclusive reach. So we are looking at the aspects of palliative care that have been overlooked, looking at marginalized populations, looking at prisoners, looking at providing care for those who are not able to pay for it. So there are different overlooked dimensions, and you're also free to say why your thought is focusing on overlooked dimensions, just based on how you explain it. So in terms of our conference that's coming up, there are guidelines that have been documented that you need to follow. So number one, we are accepting abstracts in English, and this will be submitted online. I'll take you through the submission, the online submission shortly. So please don't send them through email or SMS or WhatsApp. You'll need to submit them on the portal. Our deadline is at the end of this month, that is the 30th of September. So be sure to beat that deadline. Then we should be giving feedback within a month, that is by 31st of October. And if there are any changes, those should be communicated. We encourage you to present. You could do a poster presentation, you could do an oral presentation, and then the abstracts could also be based on research or based on projects that you're doing, as long as they're related to the 6 tracks that I've talked about. And then even as you're submitting, make sure you don't write Esther's name in your abstract as a co-author, and you've not told Esther about the abstract you're submitting. So make sure they agree, and make sure they agree with the content that you're going to present, because we may have an opportunity to publish these papers, and we would not want to have published falsified information. So if you have an abstract you want to present for something that has already been published, this may be considered for a poster presentation. So we are encouraging you to present things that have not yet been published officially. But then if you still have something that has already been published, do present this for a poster presentation. And then ethical approval is really important. So if you're doing research or studies, make sure you indicate that you got the correct ethical approvals. And even in your presentation, we encourage you as the presenter and the co-author to ensure that those guidelines are also followed, based even on where you are, the country you're in. But at least for Kenya, we know you need the ethical approval, and you also need necessary permits for you to conduct research. Marketing pitches, those can come. If you want to market something or a product, there'll be exhibition booths. So you can link up with the conference planning team so that you get to secure your own booth, and that's where you'll do the marketing of your products, but will not have them submitted as abstracts for the conference. So I'll take you through what the abstract submission looks like. We have the conference website up and running. You could put in the chat if you've interacted with this website. Just say, I've interacted with the website, the Palliative Care Conference website. So it's if you just go to Google and look for Kehpca Conference 2026, or look for the National Palliative Care Conference 2026, or just go to the Kehpca website, there'll be a tab that talks about the conference. That's where you'll get this information we are talking about. So I'll be happy to hear from you if you've already interacted with this website, and if you also have any feedback for us on the same. So once you go to the conference tab or the conference website online, you'll be able to see a screen that looks like what is ahead of you. And at the top right, there's a button written register. So remember, for you to submit an abstract, you need to have registered for the conference. So you'll have to click on register, sign up for the conference. Then that's when you'll get an opportunity to submit or put up your abstract. So once you've created your account, you'll get a notification telling you that you've successfully registered for the conference. Then you go to this button that says submit abstract on the blue bar. So once you go to the submit abstract button, or the other one that says call for abstracts, which is also available on the main conference website, it will take you to the next screen where you'll be able now to move to the next step. So click on submit abstract. It will bring you to this form. So this will redirect you out of the website, but it's still linked to your account. So what happens is you need to click on the Start Now button, and here you'll see it's telling you submit your abstract, and it's just a form. So there are questions you need to fill in, and finally click submit. So remember, once you click Start Now, there are different tabs or different sections you'll need to fill. So these sections are based on two types of abstracts. We've talked about acceptance of abstracts that are based on program work or project work. We accept that. And the maximum word limit for this is 300 words or 2,100 characters. So even as you fill it in, you'll be able to see the word count moving. So just make sure you stick to the word count even as you prepare to submit your abstract. So this is divided in 4 sections for the non-empirical or program-based abstracts. Number 1, you need to talk about the aims or goals of the work that you're going to present. And then number 2, talk about the design, or the methods, or the approach, how you did this project or how you implemented whatever you want to present. Then number 4, you have to talk about results. This is where you talk about the numbers, you talk about the value that this project offered. And then finally, you have to give us a conclusion or lessons learned. So remember, when you're writing an abstract, it's not just one paragraph in prose, but it is arranged in these 4 sections for the project or program-based abstracts. Then the second section, or the second type of abstracts we are accepting, is for empirical studies or secondary analysis or research-based systematic reviews. You might have done some research work and you want to present this. And remember, I said if it is already published, you say you want to present it as a poster. If it is not yet published, you can aim for the oral presentation. So for the research-based studies or abstracts, we have number 1, the background. You have to give a background of the work you wanted to do, and then the aims of what you want to do. Then talk about the methods, looking at the design, the data collection, and then the analysis of the data that you had, or the information that you have. And then finally talk about the results. So the results is basically what you found, what stood out, and because it's 300 words, you might not be able to put in everything. So it's for you to prioritize what you want to share, and then finally give us a conclusion on the work you have done. So both abstracts word limits are 300 words, excluding the title. The title has its own section where you will enter the information. So remember, we went to the conference website, we created an account, then we said we want to submit an abstract, and we clicked on the button that said start. So once we get to the start button, there'll be questions asking you about the name of the author. If you have more than one author, for example, it's Esther submitting this abstract, but then I did it with 2 other people, I need to list down those 2 other people who have agreed to be part of this presentation. So there'll be sections, you just need to keep adding. If you have more than one author, you put in their names, there's contact information, and then you'll also need to say who is presenting. So it's either Esther who is submitting this work, who is the presenter, or one of the other co-authors that have been listed. And then you'll need to select and say you are presenting this for an oral presentation, or you're presenting it for a poster presentation, or you are open to either. Because once you submit your abstract, the scientific committee goes back to look at the abstracts that have been submitted. There's a selection criteria. So the abstracts that are selected will now be probably approved to be included in the conference. And then sometimes if the slots for the oral or the poster presentations are not enough, the committee does a balance and says this presentation needs to be an oral presentation, or this one needs to be a poster. So that's where we get the either. If you don't mind either or being selected for by the committee, that's what you choose. So there are questions that you'll need to answer. We've talked about the authors, we've talked about who is presenting, we've talked about the co-authors, and then there's the title. You'll need to put in the title of your abstract. And then now here you select whether it is abstract A or B, whether it is research-based or program-based. So you'll select one option. And then the next questions now will tell you to fill content for either the empirical studies based on the format I'd already told you about. So you're working with a word count of 300 words based on what has already been written. So make sure you follow the guidelines that have already been put there. And then the non-empirical work, you also have a format that has been provided for you to follow, so that you're uploading information that is structured, and it's also easy for the scientific committee to review and give feedback on. So once you've filled all the sections that have been opened up to you, remember all of them you need to fill all the sections that are required. You'll now go to say submit. And remember, if you don't click submit, your abstract will not get to the scientific team. So make sure you click submit. So even as we are doing the presentation, we need to focus on a few considerations, even as we look at how do you write up your title, how do you write up the 6 sections that I've talked about. So for the title, make sure you're using clear language that is reflecting the core of your work. So talk about the impact or innovation or the challenge in the title, so that if I read your title, I already know what you're sharing, I already know what you are talking about. And then it also captures the reader's attention so that they want to know more about what you want to share with us. Then number 2, we look at the background and rationale. Now here is where you're just briefly explaining the context of your study or your project and what gap in palliative care practice, policy or community need you are addressing. Then here for background and rationale, remember you're also highlighting your abstracts or your project's relevance to palliative care and related to the theme that we've talked about for our conference. Number 2, when we are talking about the aim or the goals, we are talking about what did you set to achieve. So for example, it could be something like to improve community-based palliative care access for older persons in peri-urban Kenya. So if I read this, I already know this project was focusing on a specific region and a specific population and targeting a specific model of palliative care provision. Then number 4, we are looking at methods or the design. So here we are describing the approach. Was it a qualitative study? Was it a mixed method study? Was it quantitative? Was it advocacy driven? Was it participatory? Did it include beneficiary of services? Did it include healthcare professionals? Did it include any collaboration? So this is where your methods or the design comes in. Then number 5, we look at the results or the outcomes. And most times you'll find when someone is reading your abstract, they start with the title and then they go to the results because they want to see if it is something that makes sense to them. Is it something they want to hear more about? So you'll share your key findings. You might have had 1,000 findings, but remember our abstract has a word limit. So just share what is what had the most anticipated impact in this abstract, and then focus on how your work contributes to palliative care, policy change, or community empowerment. So that is very important. Remember, I said even as you're preparing your abstract, don't present an abstract about building and construction and present it for a palliative care conference because it does not rhyme with the conference theme. It does not rhyme with the agenda of the people attending that conference. So make sure you align. If it has a focus, your building and construction, maybe looking at something about access to palliative care for a specific location, or you're looking at a new technology that people can make use of, then see how you make sure you do align it to what the conference is looking at. Then finally, you look at the conclusion and the lessons. So for example, you're looking at, our conference is looking at universal access to compassionate and comprehensive palliative care. So what does your paper or your content mean for palliative care practice and policy? So it has to be related to our theme. And then you'll finally end with a memorable takeaway. Remember, the takeaway is what makes the person say, I want to hear more, or I want to learn more from you. And then talk about the scalability. Is it something that other facilities can focus on? Is it something that other countries can even take up and implement where they are? So if you look at those key considerations, you'll be able to do an abstract that is eye-catching. So I'll highlight a few things that we can avoid and things that we can leverage on. So number 1, some of the things we want you to avoid is sometimes we ignore the structure of the abstract and the word limit. So immediately the reviewer looks at this, they already make you lose marks, because if the abstract is not structured the way we've talked about in the earlier slides, the reader will not be willing to continue hearing or learning from you. So don't ignore the abstract structure. Number 2, if you use vague or generic language, it also puts someone off. So if you say results will be discussed, or now you're talking about your abstract and then in the middle you're telling us results will be discussed. We were looking forward to the results. So you can't tell us results will be discussed. You need to tell us the results. If you're just saying interesting findings, just tell us about the findings. Tell us about what you found. Don't use jargon. Make sure you use spell check. So we will not be happy to see spelling errors or wrong tense. Remember, for methods, it means you already did this activity. So the tense you use will be past tense. And then when you're talking about the conclusion, you're using present tense, because remember you're talking about what stands out, or what do you want us to remember about the work you have done. If you don't align with the conference theme, it is also something that will make you lose marks for your abstract. If you forget your audience, that may also make you lose marks. So for example, you're talking about content, your reviewer might not be maybe a clinical officer like you from the same county you're in. So even when you're talking about your context or whatever process or project that you implemented, make sure you provide it in a very clear language or manner, elaborate as much as possible so that the reviewer is able to understand it just as you are. So the best thing is usually to share with someone else and ask them if they are able to get the message you're passing across. Then if you don't have a clear takeaway or a call to action, that also reduces marks for your abstract. So we've talked about pitfalls, but what are the things we can leverage on? So number one is being concise and clear, avoiding jargon and acronyms. Sometimes you think everyone understands the acronyms you talk about, but use language that is understandable as much as possible. Then use the active voice. So for example, we are talking about your methods. How did we do this? You say we interviewed 20 caregivers. That is very direct and engaging, as opposed to saying caregivers were interviewed. We are left wondering how many are they, where were they, leaves more questions than answers. Then make sure you align with our conference theme. So even as you align with the conference theme, we have the 6 tracks. Make sure you align with the tracks that you will have selected. Make sure you proofread and get someone else to peer review your content so that as you're providing your abstract, you're confident that it is something which is going to leave readers engaged even as they interact with your content or even as you come to present in February during the conference. Make sure you use verifiable data. Don't just randomly pick figures. If there are any references, those will come in your presentation. You won't put them here, but make sure you're using data that can be verifiable. And respect the word limits and the formatting rules that the conference abstract guidelines have given to you. So even as we conclude this talk, there are a few key things I want to emphasize. When you're talking about a winning abstract, this is an abstract that is clear, that is concise, and that is compelling. So as I read your abstract, I should be compelled to come and listen to your talk during the conference. Most times we will have the abstracts within the conference program or online available for people to skim through so that even as they decide what sessions they want to attend come February, your abstract is what will pull them to your session. Otherwise, you might be in the room and people have decided to go to listen to someone else in another room. So make sure you do your work in a clear, concise, and compelling manner. Then number 2, your abstract distills your work into a structured narrative that is really highlighting why it matters. So why did you do the work? Why should I listen to you? Then number 2, how it was done, what methods, because rigor here comes in. How did you do your research? How did you do your data collection? How many people did you interview? What was the sample size? Did you get the correct ethical approvals? Did you get the correct research approvals? Did you engage collaborators? Did you engage different people? And then what it contributes, and this is very important, that is where your conclusion comes in. What does your work contribute to the body of palliative care? So most times you'll find someone just looking at the conclusion. What was this research about? And what does it tell us? Is there anything or any new evidence generated? And where are the gaps in terms of implementation, even as far as this abstract is concerned? Remember, even as you're doing your research, as you're doing your projects, you need to look at what gap are you trying to bridge, and what solution are you trying to provide, or what information are you trying to provide, so that we get a specific way of bridging these challenges or the gaps that have been highlighted. So here, when you're talking about the why, the how, and the what, it's in the context of compassionate, community-driven palliative care. As you're doing your abstract, align to the conference theme, spotlight stakeholder voices, the voices that were included within that project or the research that you did. Then end with a strong takeaway that invites reflection or action for the people who are coming for the conference. I think with that, if you follow those steps and you're able to also review online, there are different websites or YouTube channels you can also look up to see how have people previously written abstracts, what are the things to avoid, and then just share it with your peers so that they are able to help you come up with an abstract that is a winning one. So I'll end it there, and thank you for your attention. Back to Dr. Zippy. Asante.
Asante sana, Esther. That was very insightful discussion. I think we are now aware of what kind of things we need to do to have a winning abstract. The instructions are very clear, and I know a few people have already submitted the abstract, but as those who are now not submitted are planning to submit, they have more insight on how they should submit an abstract. So thank you very much. I was hoping there would be questions. I don't see any questions in the Q&A. I see a few things that would probably need some response. One is, this is now to Musyoki, can there be special rates for survivors? And then somebody is also asking if they can get the slides in their emails. I think they can PDF them and send them to you. And then somebody is asking, saying that after this session, I guess this is after this session, they realize they need to rectify the abstracts. Is there a way they can edit this abstract after they have sent it? And can she submit it afresh? So I'm happy that actually somebody has taken in the new information and would like to resubmit or to correct the abstract. So please, Esther, you respond to the abstract question. Musyoki, you respond to the special rates question. Then we'll take more.
Sure, thank you. On the question on special rates, in fact, the rates I projected are very subsidized, but we are fundraising, especially looking at needy and especially survivors and patients and people with lived experiences. Once we get any commitment and based on requests, if we get any request and we have that opportunity, we're usually very transparent. We'll be able to communicate that. But as at now, we haven't quite gotten any support. And this, to be very frank, the rates that we're going for are specifically for the conferencing. It's for the hotel charges and the materials and for the conference hosting. So yes, that's the status. But thank you for that question.
Yeah, maybe just to add that, as you say, that the prices put there just for the conference itself. It does not include accommodation and travel. But as Esther was speaking, I was checking on the website, and there are quite a number of places that the website has listed in terms of accommodation. So you can choose what you're able to afford on the website, and then book that place for your stay in Mombasa. So it's good that Kehpca is giving a range of accommodation for us to choose from. So thank you for that, Esther. Dr. Minga.
Okay, for the question on rectifying, we shall confirm. I don't yet have firm feedback on that because it's a form you're submitting and it goes as you submit. It's not saving on your portal, but that is feedback Kehpca will be able to give for you. The other question on the slides, the presentation will be uploaded on the Kehpca website, YouTube channel, sorry. So that should be a place that someone can go back and just listen to the presentations and get what they didn't during the session.
Thank you.
Thank you.
Yeah, thank you, Dr. Mwinga. So there's another question somebody is asking, Makilan is asking, can someone submit abstracts for ongoing research before final results? Dr. Mwinga?
Yes, Maculine, as long as your final presentation will have this research completed, because you'll not be able to present work that is halfway. Remember, I talked about the 5 or 4 levels. So yes, if you will be having that ready by February, you could still submit it for your abstract. Then talk about your expected outcomes of the study you're doing.
Thank you. So I want to ask a question that somebody has directly sent to me about goes to Musyoki and or Esther. You can answer about the pre-conference workshops. They would like a little bit more information on the pre-conference workshops, and will they be included in the conference fee, or do people have to pay for the pre-conference workshops? And secondly, are they determined already, or can somebody submit for a session for a pre-conference workshop?
Thank you for that, Zippy. The scientific committee is still discussing, especially looking at the areas or the key areas that would have pre-conferences. And so if there is interest, opportunity for whoever is asking to write or to share, so that we discuss as a scientific committee, and then we'll be communicating in the near future how, as we draw the program, which areas or which aspects would have pre-conferences. Usually we've held the pre-conference workshops on the first day, so that may still be the norm. Whether they are part of the conference or whether somebody needs to pay for them, we wanted to consider hopefully that we are able to have them open, so that whoever has registered for the conference could choose which pre-conference they would attend. So that is the plan. And just to make it clearer, we have the conference site, which we keep updating and giving information. So please keep visiting that conference website. We will share more information there. Thanks.
Thank you. David, as we were talking, I went to, following Dr. Mwinga's instruction, I went to the website and registered. When I tried to log in, it tells me my password is invalid throughout. So maybe just have your technicians look at it and rectify that, because I'm sure others might be going through the same thing. Do we have any questions? Any more questions? It looks like we don't have any more questions. So from the speakers, would you like to give us a final word? Dr. Mwinga?
All right. Thanks for the opportunity to share. I'm looking forward to more abstracts in this conference, especially of things that are done within palliative care and in Kenya. And I know we all have a story to share. So if there's a challenge, just reach out to us. We'll be able to support where we can. And you still have a few, is it 2 weeks or 3 weeks? 3 more weeks before the abstract submission portal is closed. So just register, sign up, submit your abstracts, and then start saving up for our conference coming up next year. Asanteni sana.
Thank you, Musyoki. Any parting shot?
Yes. So it's always a pleasure to have this kind of sessions, and this conference belongs to all of us. It's yours, it's mine. We are a family, and therefore we looking forward to having as many as can come to the conference. Just to emphasize, we have lipa pole pole, and so if we pay 2,000, 3,000, by the time it gets to February next year, we'll have paid up that registration. So we're encouraging everyone, and the work you do in the different places is very important. So be proud of your work and write an abstract. I've seen a few people saying, since we have not yet secured, they haven't secured funding yet. They are waiting until they secure funds to write the abstract. But I would look at it in the reverse, that submit the abstract and using that as a justification, then look for funding. So that's my encouragement, and I look forward to having all of you in Mombasa and many more. I saw a question, Zibi, from Michael.
Yes, Emily has responded, but it's good to mention is that everybody yes.
Yes, so one can submit more than one abstracts as long as they are talking about different things. Yes, the deadline for registration, we do not have a deadline, but probably a week to the conference for planning purposes. So the earlier the better, but the conference registration is open all through. We look at the IT registration bit. Paul is in the call, and I'm sure he'll be able to fix that like almost immediately. Thank you.
Thank you. So I want to thank everybody for taking an hour of their evening supper time, especially those moms who have to cook for their children, take kids to bed. Thank you very much. And I also want to congratulate Kehpca leadership and the Kehpca team for the work they're doing. And also Dr. Mwinga, this is the first time that we are having a joint conference, Kehpca with the Ministry of Health logo on our conference. So this is a big plus. For those of you in palliative care, this means there's a huge recognition of palliative care in this country by our leadership. So we should pat ourselves on our back. We've done a good job. Thank you very much, everybody. Have a good evening and see you in Mombasa. Kwaherini. Thank you.
Thank you. Good night.